Finally, let's turn to a critical area, one that tragically cuts across all these mental health discussions: suicide attempts. Our sources are incredibly clear. All suicide attempts must be taken seriously, especially given the sobering statistic that a quarter of all attempts occur in young people, those aged 15-24. And while females aged 15-19 have the highest rate of attempts, males, unfortunately, have a significantly higher rate of completed suicides.
That's right. And young people who attempt suicide have significantly higher rates of underlying mental illness, things we've discussed, like depression, anxiety, bipolar disorder, and substance abuse are very common. But the reasons are often complex and varied. It might be difficulty coping with really distressing life events, like parental separation or intense bullying. Sometimes it's feeling completely overwhelmed, maybe lacking the coping skills to manage intense emotions, feeling desperately isolated, or tragically believing that nothing will ever help or get better. As GPs, you also need to be particularly aware of the unique needs and vulnerabilities of marginalized groups who may face additional stressors and barriers to seeking help.
So what is the immediate urgent action required if you believe a young person, or indeed anyone, is at imminent risk of suicide? This is where seconds really count.
Yes, and the sources are very direct and practical here. This is absolutely critical knowledge. First, seek professional support immediately. Contact your local mental health service crisis team, or direct the patient, or ensure they're taken, to the nearest emergency department. Second, keep the young person safe until that help arrives. This means actively removing any immediate means of suicide available in the vicinity. Check for medications, weapons, anything they could use. And crucially, stay with them or arrange for continuous supervision by a responsible adult until they can be properly seen and assessed by a mental health professional. Never leave them alone if you assess imminent risk.
And for general referral purposes, if you're ever in doubt about the level of risk, even if it doesn't feel immediately imminent, what's the safest course of action?
Always, always err on the side of caution. Refer them. Depending on the context, this could be to a school well-being staff member, if they're school-aged, or directly to a mental health professional or service. Document your concerns and your referral clearly. It's also really important to remember that supporting someone who has attempted suicide is complex, and it can understandably cause significant anxiety and distress for you as the professional involved. So, accessing self-care resources, debriefing with colleagues, and seeking support for yourself is absolutely essential in this demanding line of work. Don't neglect your own well-being.
What an incredible amount of really vital information we've unpacked today. From those nuanced diagnoses in anxiety and bipolar disorder to the practical management strategies for schizophrenia, gambling, and that critical immediate response to suicide risk. It's abundantly clear that your role as a GP is just so much more than initial contact and diagnosis. It extends deep into long-term management, that crucial physical health monitoring, and knowing when and how to make effective referrals across this whole wide spectrum of mental health challenges.
Absolutely. If we sort of connect all these threads back to the bigger picture, it really highlights how truly comprehensive and frankly demanding general practice needs to be today. You are often that consistent thread in a patient's care journey, providing that vital therapeutic alliance, that continuity, and expertly navigating those complex comorbidities, both physical and mental, that specialist services focusing on one area might not always see with the same holistic view.
So what does this all mean for you, the dedicated GP listening today? It's really about empowering you with the practical tools and that nuanced knowledge to not just identify these conditions, but to actively manage them confidently, even when specialist services might be stretched thin or difficult to access quickly. And perhaps a final thought to leave you with. Given the profound, undeniable impact of mental health on physical well-being, and of course vice versa, how might a deeper, more systematic integration of proactive physical health screening transform early intervention possibilities for all patients who present with mental health concerns in your practice moving forward?